Hi everyone, my name is Vanessa Gepielago and today I'm going to be talking about the family health promotion theory. What I'm going to be discussing in this PowerPoint is what the theory specifically covers, what model is derived from this theory, the nursing interventions recommended, current evidence-based practice that's based off of this health promotion model, specifically the family health promotion model, and the application to my own practice. All right, let's start off with what the family health promotion theory even is. It is a theory that was derived from Pender's health promotion model, formulated by Nola J. Pender, and it was a supplemental or counterpart to models of health protection. The major concept of Pender's health promotion model was that individual characteristics, experiences, learned behaviors, and the frequency of those behaviors in the past have a direct and indirect effect on the likelihood of engaging in health promotion behaviors. So in 2004, Loveland, Cherry, and Bromar presented the theory's application of Pender's health promotion model and centered the family at its core instead of the individual. So whereas individual behaviors affect health outcomes, the family health promotion theory points out that the family as a unit influences behaviors that result in either positive or negative health outcomes and quality of life. This health promotion theory focuses on physical, social, emotional, and spiritual well-being of the family unit and its members. Learned behaviors and environmental behaviors, all those effects are passed on from generation to generation, and the perception of health, along with the byproduct of factors influencing behaviors, have an effect not only in the home but out of the home as well. So on this slide, I'm providing an example of the family health promotion model that providers can use to better understand how the family dynamic works and how to understand why health promoting behaviors are stemming from the family source. This was developed by Cherry, Loveland, Bromar in 2004. And as you can tell, it goes from the family's general influences. This is the family unit as a whole, how they perceive their health, what behaviors surrounding the family unit influences their perception of health promoting behaviors, whether it's good or bad. So each one has a direct effect on the other, stemming from what the dynamic of the family unit is, as far as, like it says, family system patterns, demographics, genetics, characteristics that are passed down from generation to generation. So the key concepts of the family health promotion theory: in regards to the family, our goal is to increase family unity and quality of life by influencing health promoting behaviors. The definition of the health is in regards to what the family's perspective is on it already. We find the deficits and we teach. The environment has surrounding factors that can influence either positive or negative behaviors. And as far as nursing, we need to tailor our interventions in regards to how the family perceives its health, what the deficit is, and that's how we address the nursing interventions. So application to nursing practice and interventions. So our goal is empowering family members to work together to attain and maintain family health. Focuses on strengths, competencies, and resources. That's what this theory is all about, is getting to the root cause of the family deficit, incorporate new changes, and have an outcome that leads to health promoting outcomes for that family unit. We promote change and encourage use of resources, and care plan is clear, concise, logical, structured, and is formulated with the patient or family client. So to better understand what's important for families, Kakinen et al. Did a finding from a focus group done by Carolyn Vickers to evaluate what topics were important for families in general. So we can't assume what the family wants, we have to ask. So as it says, families preferred holistic approaches. We want to know what their strengths are to encourage health promotion activities, education, and healthcare. We give them more knowledge. It's not like we treat them like they don't have any knowledge, because a lot of the times, according to this focus group, they have knowledge, but we grow upon that knowledge. We address from food, nutrition, obstacles, current influences of technology, of how our society is today, and give resources, other families that are willing to share tips, and give them affordable resources within their means. So let's talk about nursing interventions derived from the family health promotion theory itself. The first off is a family self-care contract. It's a very specific working agreement, and it's signed by all the family members. So this is family derived. They identify an area of improvement. We help them set a goal, develop a plan of how the goal will be achieved, assign responsibilities within the family members so everybody has accountability in order to achieve this goal, set a time frame, how often, 2 times a month, every Friday. At the end of the week, evaluate the outcomes. So there's a regroup day of how the family can do better, and they end up collaborating with each other. So it's not just one person, it's the family unit as a whole. Modify, renegotiate, or terminate after a couple months of trying to achieve the goal of this self-care contract. The second is family empowerment. This is basically playing on the strengths of the family. So what they did that was good during this round, but how can we make it better? We offer that new opinion to help them achieve the goal that they want to achieve, or maybe offer a different way to do it so they can have a better outcome. So this is not playing on their weaknesses. It's not saying you did this wrong and this is what you need to do XYZ. It's no, you did this really good. So how can we do it better the next time? We offer information, give education, and obviously provide resources that the family chooses. Next is respecting rituals, especially culturally. We respect the rituals and we work around it. How can rituals lead to family bonding, and how can that lead to better health outcomes? And then structuring a routine. So each family member, again, is accountable, come together as a unit, helps each other, and formulates a routine so everybody is able to reduce less stress on the other person. And promoting family healthy meal times. By coming together and sharing meals, this can create family bonding and lead to fewer health risks associated with children and teens. So how can this theory be applied to research today? There's actually quite a few uses of this theory in today's current research. Putra et al. In 2019 specifically applied the health promotion model to patients diagnosed with diabetes type 2. And their goal was, how can patients with diabetes type 2 engage in self-promoting behaviors? What was the barriers and how can we address those barriers in having interventions tailored to them? So 177 patients were diagnosed with diabetes type 2, new onset diagnosis, and a qualitative cross-section design was used to evaluate the health promotion model. Studies showed that the family support had a 23.2 influences on these patients, and the importance of family support and engagement led to better outcomes and increased self-care among diabetes type 2 patients within this study. So all in all, 4 issues that were impacted were socioeconomic status, level of education, perception of illness, so this is all environmental and health issue behaviors, again supported in our model, and family support. So utilizing the health promotion model can help providers understand and formulate interventions that address the barriers to self-care deficits within this study. The second research study that utilized the family health promotion model or theory was Gepielago et al. 2014, where they performed a randomized control trial that addressed educational interventions on health promotion and quality of life for methamphetamine users and their families. The trial utilized methamphetamine users in the relapse stage and recruited one of their family members to participate. And they used models such as Penner's health model and the family-centered empowerment model. So 2 intervention groups and 1 control group. At the very end, it showed that the intervention group compared to the control group showed significant results when utilizing Pender's health promotion model, family-centered empowerment model, and it used the health promotion lifestyle scale and health-related quality of life scale. At the very end of it, the study showed that family-centered empowerment model led to better outcomes and improving quality of life and improved overall health for methamphetamine users and prevented relapse. So in conclusion, we address the why and the how. Why is because we want to understand the family as a unit and how the health promotion theory and model provides structure to better understand these families so we can identify the root cause that ends up affecting health and quality of life for our specific patient. And in order to take this theory, we can apply it to the family assessment project by coming up with interventions that include family influences that can promote better health outcomes for our patients. That is why it's important to apply this theory to the family assessment project as a whole to come up with a care plan that suits the family needs and the family goals. Thank you for listening. Here are my attached references and have a great day.